Did you know there's a tiny organ in your gut that can develop a tumor most people have never even heard of? Appendix cancer is rare, often silent, and many times discovered by accident. Yet it can be life-threatening, and knowing the signs could make all the difference. Today, we'll uncover what appendix cancer really is, why it's forgotten, the subtle symptoms, and what modern science is doing to treat it. Welcome back to the channel. Let's dive right in. First, what is appendix cancer? Imagine this small pouch attached to your large intestine. Appendix cancer is an uncommon gastrointestinal tumor, representing less than 1% of gut cancers. So why do I call it the forgotten gut tumor? Well, 3 reasons. First, most people don't think of their appendix as a potential source of cancer. They associate it with childhood illnesses like appendicitis. Second, it's rare, making up only a small percentage of GI cancers. This means many doctors don't encounter it often, leading to a lack of familiarity. Third, appendix cancer is often hidden behind other gut conditions. Its nonspecific early symptoms get masked by things like irritable bowel syndrome, making it harder to spot. Now let's talk about the types of appendix tumors. There are various types, including carcinoid tumors, which tend to grow slowly. These can be quite tricky because they may not cause any noticeable symptoms and often get discovered by accident during surgery or imaging studies. Then we have mucinous neoplasms. These tumors can produce a jelly-like substance called mucin. And here's where things get interesting. The mucin can spread inside the abdomen, creating a thick fluid around the organs. This unusual finding is known as pseudomyxoma peritoni. It's like having this gelatinous material in the abdomen. It's rare and can be quite challenging to diagnose because it mimics other conditions. Adenocarcinoma is another type, and it's considered more aggressive. It resembles colon cancer and tends to affect older adults. Finally, goblet cell carcinoma is like a hybrid tumor, combining features of both adenocarcinoma and neuroendocrine tumors. Doctors often discover these during surgery for appendicitis. Imagine waking up from an operation only to find out you had a tumor. It's quite a shock, but highlights how important it is to understand the unexpected. So what are the symptoms people often miss? Since appendix cancer is sneaky, it can throw people off guard. Many patients experience persistent abdominal pain, which they or their doctors might misdiagnose as appendicitis, irritable bowel syndrome, or even gas. Other common symptoms include bloating, changes in bowel habits, and unexplained weight loss. The problem is that most early symptoms are subtle, leading to late diagnoses when the cancer has spread. How is it diagnosed? As mentioned earlier, it's often found unexpectedly during surgery to remove the appendix. But why wouldn't a scan like a CT or ultrasound show it? Well, these tools help, but are not always definitive. Imaging techniques like CT scans, ultrasounds, MRI, and even certain blood markers can help, but they aren't always definitive. Sometimes it isn't until the pathology report after surgery reveals the diagnosis. What happens when it's found? Treatment depends on the type and stage of the cancer. Surgery is usually the first line of defense, ranging from an appendectomy to a right hemicolectomy. If the tumor is more advanced, the team might use cytoreductive surgery, followed by HIPEC. HIPEC stands for heated intraperitoneal chemotherapy. It involves putting the abdomen open and washing it with heated chemotherapy. The heat helps open the blood vessels so the chemo can reach all the cancer cells. After surgery, additional chemotherapy and targeted therapy may be recommended if the cancer has spread. The good news is that with proper early treatment, most patients can enjoy long-term survivorship. Why does awareness matter? Even though appendicitis is a common condition, awareness of appendix cancer is not. Early detection is key, as it often doesn't cause noticeable symptoms early on. People tend to ignore their gut feelings. However, when something doesn't feel right, it's essential to keep pushing for a proper evaluation. Knowledge is power. The more informed you are about your body and potential risks, the better equipped you are to advocate for yourself. In conclusion, the appendix might be a small, forgotten organ, but the risks of ignoring its cancers are not. Catching it early can make a world of difference. Until next time, Stay curious, stay healthy, and remember, your gut feeling might just be right. If you found this video valuable, share it with someone who could benefit. Your small action can make a big difference in someone else's health journey. Thanks for being a part of our community. See you soon.